Being diagnosed with breast cancer can be shocking and overwhelming, and many women wonder if they'll survive, and if so, will they lose their hair and maybe even their breasts? Well, St. Vincent's Riverside offers breast cancer patients a newer form of breast reconstruction surgery, which allows patients to have a tummy tuck at the same time as their breast reconstruction, all with a quicker recovery. Next week, St. Vincent's is putting on an event so the public can learn about breast reconstruction and get the chance to talk to survivors who have had the procedure and other forms of breast reconstruction. Casey's with our next guest right now with more on the event and a procedure that's giving new hope to breast cancer patients.
Yeah, October is Breast Cancer Awareness Month, and St. Vincent's Healthcare is hosting a free breast reconstruction event at St. Vincent's Riverside. The event will offer education and opportunity to patients to talk about other women facing the same cancer journey. And joining us now is Dr. Michael Fallucco and nurse navigator Tanya Brown. They're here from St. Vincent's to tell us a little bit about the event and also the DIEP flap procedure. And Dr. Fallucco, we'll start with you. And very simply, what is the DIEP flap procedure? What's that all about?
The DIEP flap is one of the most advanced forms of breast reconstruction when a woman's breast is removed following cancer. What we do, very similar to a tummy tuck, where we use the skin and fat from a woman's belly to recreate the breast. And the main advantage of the DIEP flap versus conventional tram or other ways where we use the belly tissue is there's no muscle taken. So it's a quicker recovery, there's less pain, in a very natural appearing breast.
And Tanya, this is really about self-esteem for a lot of these women who have had to go through the cancer treatment. They've lost their breasts. So this is something to help get them through it.
It is. It can take an emotional toll on a woman to lose her breast. It's something we don't look forward to, but reconstruction at the end makes it all better. It's something that you can look forward to as a reward to everything that you've been through, and it helps build your self-esteem, your confidence back up.
Yeah, and really quickly, this is something that you know firsthand because you are a breast cancer survivor.
I am a breast cancer survivor that did undergo reconstruction and was very happy with the results, pleasantly surprised after I saw the end results.
Well, let's go ahead and take a look at more about this DIEP procedure. And St. Vincent's Healthcare's Alyssa Tressel, she's going to introduce us to one local woman who had the surgery and is now getting, she says, her life back as a result.
Ann Berry has been a nurse for 40 years. Over the last several years, she has worked with cancer patients. That's why it was so ironic when she herself was diagnosed with breast cancer.
It's a very rocky road and roller coaster that any person who starts on this journey goes through.
Ann knew she was going to lose both her breasts and wanted reconstruction surgery. She made the decision to forego the implants and opt for the DIEP flap procedure, an advanced form of breast reconstruction surgery where the surgeon uses the patient's own abdominal skin and fat to reconstruct a natural soft breast.
It's a way to use your own tissue from the belly, like a tummy tuck, where we take the skin and the fat.
Dr. Michael Fallucco says unlike the tram flap, the DIEP flap preserves the abdominal muscles. As a result, patients experience less pain after surgery and a faster recovery without the need for implants.
The advantage mainly is it's their own tissue, so that tissue will grow with the patient. They don't have to worry about implant concerns, the implant getting hard, or exchange in the implant in about 15 years, which is about the life of an implant.
Many patients who have this procedure enjoy the added benefit of a flatter abdomen with results similar to a tummy tuck.
Your whole figure changes for the better.
As you can see in this case, 2 surgeons are performing the procedure.
It's safer for the patient. You really have 2 surgeons working under the microscope when we transfer that tissue to the breast. It's faster for the patient and overall more precise.
Ann encourages other women to explore all their options. Now, a proud survivor, she looks back and says she's thankful she made the decision to have the DIEP flap. She was able to move on from her diagnosis and get back to her job, back to her family, and back to her life.
For me, I wanted to see this out. I wanted to do the entire journey with the reconstruction and a couple of other things that you come along doing. And it was important for me. It's part of you, and it's just as, to me, it's not just cosmetic surgery. This kind of surgery was the best thing for me.
And that is a great story. You like to hear those success stories of people who say their lives have been changed as a result. And then, Dr. Fallucco, when is this procedure generally performed?
We perform the DIEP flap both immediate and delayed. So immediate, when a patient is having their breast removed for cancer during the mastectomy, we'll do the DIEP flap. So when they wake up, their breast is reconstructed. Or after radiation, then we perform it in a delayed fashion. Some patients who've even had implants and don't want to have implants anymore will remove the implants and perform a DIEP flap. And thanks to St. Vincent's, we've been able to perform some of the largest numbers in the southeast of DIEP flaps.
Wow, because this is a relatively new thing, would you say, for this area?
It is. It's new to Jacksonville.
Which is a great thing, and you know, having gone through it. Now, you guys have an event going on. What's it all about?
We do. On this upcoming Wednesday, October 17th, it's National Breast Reconstruction Awareness Day, and we'll be hosting an event. Seeing that part of our mission at St. Vincent's is to give back and empower our community, we're giving back and opening the opportunity to educate about their reconstruction options. It's open to anyone interested, those that have already had reconstruction, those that are considering reconstruction, those that have been newly diagnosed. We'll have the actual implants there that they can feel, touch. We'll have pictures. Dr. Fallucco will speak. We'll also have volunteers, those that have already had the surgery done. They will be there to talk one-on-one with participants that come, and if they would like, privately view their procedures that they had done.
So it's an opportunity to meet Dr. Fallucco, and will you be there as well, Tanya?
I will be there, and the cancer services staff and other areas of cancer care will be there as well.
Well, fantastic. Well, thank you, Dr. Fallucco, for being here, and Tanya, we appreciate it. We also want to thank Alyssa Tressel, who, you hear her voice, she's usually sitting right over there through the whole thing. We want to thank St. Vincent's, of course, for sponsoring this segment. And if you're concerned about breast cancer and you might be at risk, you can also take advantage of any number of screening exams. You can call the nurse navigator, Tanya Brown. We're going to give you her number, 904-308-5389. You can also visit www.jackshealth.com. You can go right to their cancer section. In addition, don't miss that breast cancer awareness event, which is what they're calling the BRA, which is the Breast Reconstruction Awareness, BRA. Got it? It's the event on October 17th, 6 p.m. Dr. Fallucco, others will be there. Nurse practitioners, much more. They're going to walk you through the journey. Patients who have already had the experiences of breast reconstruction surgery. So that and much more coming up. It'll be one weekend from yesterday, and it's on the first floor of the Mary Virginia Terry Cancer Center at St. Vincent. Yes. There's a lot of information, so just go to the website, wouldn't you?
Yes, that's the easiest.
You can also call the number 308-6155 too if you want to go right through it and get all the good stuff.